Daylight saving time begins at 2 a.m. on Sunday, meaning the sun is going to set later. But most Americans lose an hour of sleep. Many experts point to the change's adverse health effects, and a lot of Americans would rather just avoid switching back and forth. Joining us now is Dr. Fahmi Farah, a board-certified invasive cardiologist. And Dr. Farah, it's a hot topic around this time of year. So how does the change really impact our health?
It actually can impact our health. Yes, studies have shown that it can. Sleep is one of the risk factors for cardiovascular disease now, and that losing that 1 hour of sleep can really disrupt a lot of people's circadian rhythm, especially those who have already pre-existing sleep disorders like sleep apnea, insomnia, and not being able to get that adequate sleep can increase their risk factor for heart attack and stroke.
And people kind of joke about it sometimes, but it really does mess people up. What's the best way to get your body clock back on track?
It really is all about not allowing the circadian rhythm to change too much. And so you can gradually introduce the change, especially during this time of the year when you're losing an hour of sleep. I suggest trying to gradually introduce it for like a week or two before the time change by increments of 10 to 15 minutes, so that when the time comes, your circadian rhythm is not shocked and it can adjust to it much better without realizing any change.
That's much better advice than I was thinking. Maybe an hour. Like just do it, like practice ahead of time. 10 minutes, that's a good idea. A lot of people are going to be feeling groggy or jet lagged next week, which can be downright dangerous. What happens when people are trying to go about their day feeling groggy or tired?
Well, when it comes to work, obviously the productivity goes down because you're just tired trying to get adjusted. But you're right, it could be dangerous as well. People can get into car wrecks, accidents on their way to work or back from work. And so those are the things that we need to consider in addition to health effects that it can have.
And where can we go for some more information?
American Heart Association would be a good place to start for all sorts of heart healthy tips and advice. And as you know, we have sleep disorder has been added as one of the major risk factors for cardiovascular disease. There's a lot of information on that as well.
Dr. Fahmi Farah, thanks so much for joining us on Good Day at 4.
Thank you for having me.